Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in.
Paper poppy, paper poppy, paper poppy, paper poppy, baby bubble, baby bubble, baby bubble, baby bubble, paper poppy, baby bubble, paper poppy, baby bubble, paper poppy, baby bubble, paper poppy, baby bubble.
Kat, what are you doing?
I am doing a vocal warm-up, which you probably should do too.
Yeah.
Listen, I heard my voice in a couple of these past episodes, and I am desperately afraid that my beloved college speech teacher is going to hear this, and I'm about to get a phone call. So, Susan, I'm on it. I'm reworking this stuff. Paper poppy, baby bubble, paper poppy, baby bubble, paper poppy, baby bubble, paper poppy, baby bubble.
I do apologize. My lovely wife and co-host is a former theater major.
Please.
And, current and is still always the star of the show and star of any room she walks into. So she takes her craft quite seriously. So I'm appreciative.
As one should. Susan, call me. I need to go back to class.
Well, welcome Stream Team to another episode of Balls Deep. Dr. Joe Pazona. Of course, you've already met Kat Williams here. Kat, what are we going to discuss today?
So today we're going to jump back into a topic we talked a little bit about before and do a little bit of a deeper dive on the prostate. I'm going to say it again, prostate, not the prostrate. Everybody got it? Okay, but we're going to talk about the enlarged prostate today.
Sounds good. Well, I think jumping into a prostate sounds right up our alley.
Yeah, let's go.
All right. So with that, let's go for it. Let's go.
Balls Deep.
So the enlarged prostate, you talk about this all the time. I get it. It's an organ, an item in the male body, not my body, but in men, and it can become enlarged, and there are issues associated with that. So give us some rundown. What is an enlarged prostate?
Yeah, well,
why is it enlarged? Why do we care?
So great question. So for those of you who may have noticed on our last episode as well as this, these are not Catherine's snacks for later.
Well, they were.
Although I would not be surprised if she picks one up and starts eating it at some point.
I have not had lunch.
But we don't feed the help around here.
No.
So the prostate gland. So if we take a look at this ping pong ball, this is, the size of a prostate in a young man. So before it starts getting enlarged, it's only about this big. And as a refresher course, this sits right behind the pubic bone below the bladder. And as it goes from ping pong ball to, there's a little oblong, but if we imagine sort of a kiwi like this, the prostate's now slightly enlarged. We tend to talk about prostate in grams. So, this might be a 20 to 25 gram prostate, and this might be a little bit closer to, say, a 40 gram prostate. As it gets bigger, it starts not only growing in its physical size or total volume, but it actually is growing internally. So there's this...
What does that mean?
So there's this misconception that the male urethra through its entirety is kind of like a garden hose, right? Just a round circular tube, and that it runs, right through the middle of the prostate. Okay. But actually the urethra and the prostate are one and the same. So when we get a visualization of the prostate, when I'm looking in, say, with a scope, the prostate inside does not look like a garden hose running through it. It actually looks like two butt cheeks. And these butt cheeks are kind of kissing and touching. And so when a man wants to urinate, we rely on the prostate relaxing open so the urine can flow between the butt cheeks and there's more of a bit of a cannon.
It's a pass through.
Exactly. And so again, it's not some hollow tube that's just like cored straight through the middle of this. It's again, these two, we call them lobes of tissue. we talk about men having lateral lobe hyperplasia, or two butt cheeks that are getting big. Hyperplasia means too many cells. So as it grows internally, now as the bladder fills up with urine, it's going to try and squeeze, but these lobes of tissue won't pull apart because they're tense, because they're big, and now a man has urinary difficulties.
Okay. That makes a little bit, I'm trying to put a visual sense to that. I feel like I need some Google behind that, but I think I get it.
We're not highbrow enough as a podcast to go throwing in some fancy editing and
but
visuals.
We could get there.
Maybe we'll figure it out. We'll ask Anthony, our producer, here to see if he can throw up some visuals. This is not a high-end show, people. That just sounds exhausting. But Google's great for that. Look up some pictures. But, so if we think about that the prostate's sitting below the bladder and is causing this blockage, we think about what are the symptoms a man's going to come in with. And so interestingly, the first symptoms are not symptoms of blockage, but they're symptoms of irritation. So the analogy I use when I explain this to my patients who come in is, imagine the room that we're sitting in is the bladder, okay? And we all want to get out the door at some point. If we noted that door was starting to close down, okay, as our room started filling, aka urine building in the bladder, when the room gets partly full, we're gonna be like, I'm getting out of here because this door is closing down. So the bladder actually senses, it gets irritable as the prostate enlarges and impinges on the flow. And so one of the first subtle signs of an enlarged prostate is we start waking up to go to the bathroom. So men in their 40s will come in and they'll go, I used to hold my bladder all day. I could sleep all night. Now I'm kind of waking up 1 or 2 times to go to the bathroom, and it's irritating.
So that's a symptom. Getting up to go to the bathroom multiple times at night, disturbing your sleep, is a symptom potentially of an enlarged prostate.
Absolutely. Now we'll get into kind of how we discern between what's from an enlarged prostate, an overactive bladder versus lifestyle. But hands down, the most bothersome symptom, and often the very first one, is that waking up at night. We then will couple that with 2 other symptoms: urinary frequency. So the definition means you're urinating more often than every 2 hours, and urinary urgency. When I gotta go, I gotta go. I used to have a little bit of a warning and I could take my time. I could hold my bladder all day. It wasn't a big deal. Now it's like, when I get that sensation, I'm running, or I might dribble. So I remember that as fun. Frequency, urgency, nocturia, fancy doctor term for waking up at night. Those are what we'll call the irritative symptoms. Now, men can also present either primarily or in addition to with what we'll call obstructive urinary symptoms. This is when the guy complains of dribbling, hesitancy. He can't get it started. This is for the guys who stand at the urinal and it's just like it won't get started. The stream is weak, and actually not emptying your bladder completely as sort of a more concerning end stage of this. Of now the bladder is so pooped out, not only is the stream weak, you're going a lot, it won't even expel all the urine. Is that part of the enlarged prostate? Is that due to the enlarged prostate, the things you just mentioned? Yeah. Yes. I mean, we've got to look at we got to start looking at bladder health very similarly to how we look at heart health. So if we look at sort of a spectrum, when the prostate first causes a blockage and irritation, you're going to get these, again, irritative symptoms. Then your stream starts slowing. Now, what's happening to the actual bladder during this? The bladder is starting to undergo changes. So the first thing it starts to do is it builds up its muscle, right? If you put something under resistance, right? It's why we get bigger muscles when we lift weights. Well, the bladder wall gets thicker. So we start seeing something called bladder wall thickening. Mm-hmm. Something you might see on a cystoscopy or look in the bladder or like an x-ray test. Okay. You can also start getting, as that progresses, scar tissue forming, a fancy doctor term called trabeculation. And you may not see this until you get a CAT scan in your 60s and it says bladder wall thickenings with trabeculation suggest bladder outlet obstruction. That's all fancy doctor terms for your prostate's starting to cause a blockage and your bladder's starting to change. And then ultimately an end stage bladder is now a bladder that will not empty. And this is the men who come in and go, I haven't peed in 6 hours. I'm miserable. They're usually not talking this calmly. They're usually crying and begging for a catheter to be placed. The bladder just had a heart attack in that situation. So it's one of those things where I want to get across to all of our listeners and viewers that stoicism's good to a degree, but when, man, it comes to your health and your prostate, you might be doing some silent damage because that waking up at night, the slowing of the stream, and this progression that typically happens over years, this is usually not like an overnight thing that happens, can lead to a bladder heart attack. And there are some guys, luckily it's not that often, who get to me too late and I can't do anything. You know, the bladder, other than the brain, are the two organs in the body we can't transplant and replace. So
Wow.
once your bladder goes, it's gone.
That's it.
That's it. So I jokingly tell men when they're coming to see me to consider prostate surgery, I can get you a 6-lane highway, but if the engine on the car is shot, you ain't going anywhere. And so
True.
we had to just be mindful that the bladder does have a limited amount of damage it can sustain. And so we want to really be a bit more proactive. And that's our goal of this show in men's health, to say, hey, listen, waking up at night, it's not just a nuisance. It might be causing some real damage.
Okay, to that end, then, give us a little bit of a sense of what is normal. I'm thinking specifically about getting up to go to the bathroom at night. What's normal versus abnormal? What are we looking for? What should men be looking for?
So this is a great segue, I think, into how we as urologists tend to approach men who come in complaining of symptoms. And again, for the sake of this discussion, we're not talking about frequent urination in women. We're going to get to that in an episode or two.
This is just for the guys.
It's just for the guys. So part of it is we've got to do a detailed history and talk about your fluid intake, because it's simple math, people. What goes in's got to come out. And now, unless you are sweating profusely and exercising and working out in the heat, most of it coming out means you're urinating it out. So if you drink a gallon of fluid a day, you're going to pee a gallon of fluid a day, assuming you're not dehydrated and have other conditions going on. So the first thing we're going to do is a detailed medical history and look. So it's one thing to say it's abnormal to pee every 15 minutes. It's another when it's related to you woke up and drank a pot of coffee and you haven't had a bowel movement, or you drank 3 beers at night and then you woke up 4 times.
That's not an enlarged prostate. That's you drank a lot before you went to sleep. And
Exactly.
That's a lifestyle situation.
Absolutely.
Okay.
So what and how much you drank plays a vital role in how often we go to the bathroom. We then also have to look at other medical conditions. So a big one that we talk about a lot in this show, diabetes. So when you have diabetes, you have elevated blood sugar. Sugar is a bladder irritant. So if you have uncontrolled diabetes, you're going to pee all the time. You're going to, and over time, you can get nerve damage to your bladder. So there's some diabetics who don't empty their bladder well. So these are all things that we've got to kind of consider. In addition to things like heart medications, some people are on water pills called diuretics. They're going to urinate very often. We've talked before about the importance of sleep apnea, where people are snoring, causes you to wake up a lot at night to go to the bathroom. So one of the first things we've got to do to parse out normal versus abnormal is to make sure there aren't confounding questions. But all that being said, it really comes down to how much it bothers you. I've got some guys who come in and see me. They wake up once at night to go to the bathroom and they are miserable. Now, I don't have much of a room for improvement, right? You can't always get perfection, and you can only rewind the clock so much. So, it's really a matter of when you start noticing symptoms and they're bothersome, you should probably come in. Or if you've got symptoms that have been going on for several months to years and they're progressive. So
they're getting worse.
It started with 1 time a night. Now it's 2 to 3 times a night. Your stream was pretty good. Now it's starting to slow down. This should be a warning sign. But if you're a 22-year-old guy and you pee a lot, it probably means either you're really anxious or you got to cut down the energy drinks. It's not your prostate. So, it's a very nuanced discussion, I think, is the true answer to your question. But the bottom line is, if it bugs you enough, this is what we specialize in. This is why people come see us at Pazona MD here in Nashville. It's because we're really good at figuring out what is lifestyle and what is not. We don't just assume every man has an enlarged prostate, throw pills or surgery at them.
Well, on that note, if you have an enlarged prostate, and if it's diagnosed as that, and it's a serious condition, there are surgical procedures to assist that. Tell us a little bit about what those are, how they work. Do they work long term? Give us some more insight into surgical procedures for enlarged prostate.
Yeah, if it's all right with you, I think it'd be worth just commenting on medications, because
Sure.
rarely is someone coming in and they haven't tried a medication.
So a medication comes first. That's something to try long before you have a discussion about a potential surgery.
Not necessarily.
Okay, I'm going to back it up.
So again, here's where the art of medicine comes in, and sadly, the sort of the business side of what we do. So unfortunately, most insurance companies, you know how I love insurance companies.
No one does. They're horrible.
Future episodes on these wonderful people. Most insurance companies will pay for a medication, but not pay for a surgery, or want you to, quote, fail and try a medication, despite the fact that some of these medications can have very alarming side effects. You know, we tend to push pills. And then there's other cases, paradoxically, where they'll pay for the surgery, but they won't pay for some medicine that works. So it comes down to the almighty dollar, you know, sadly. But that being said, medications certainly have a role. So we'll go over just briefly three kind of big kinds.
Okay.
So the first one being over the counter. We see so many prostate supplements, super beta prostate, you know, all these infomercials.
Are these things anything? Or are they just, is it just bunk?
Again, I could go off on an hour in my thoughts on all of these things. There's no doubt that there are natural occurring compounds that can help alleviate medical symptoms. You're going to get no argument from me there. And then I think traditional medicine, we missed the boat there. There's a big opportunity, big into functional medicine, nutraceuticals, definitely a role. The problem comes with what sort of quality are we getting with these supplements? How much science is really behind any particular supplement you're about to take? And how predatory are the people who are trying to sell it and just trying to make some money? So that being said, there's some good basic science with supplements, but if we look at most of the studies in the prostate supplement space, they're about as good as a sugar pill. So my take typically is I'm not going to often prescribe or recommend a supplement for prostate symptoms because we just don't have the data. Now I'll prescribe or recommend other supplements. So again, don't mistake this for thinking I'm just an old school doctor who pushes big pharma. No, but in the prostate, enlarged prostate space, we don't have great data. But if you're on something and it works, great. Probably the big one people will see is saw palmetto. Zinc is used as a prostate supplement as well. So again, if it works for you, great. Am I going to typically recommend this? No. Then we've got the prescription, and just briefly, two big categories. So the first one is called an alpha blocker. So if we go back to the anatomy and what that does, alpha blocker is blocking a smooth muscle. What's a smooth muscle in this case? It's the bladder opening and the prostate. Remember, we got those two butt cheeks that won't open up. Let's relax them. So we're not treating it because it's, quote, big. We're treating it because it's tense, because it won't open up and allow the stream, because it's causing a functional blockage. It's not just simply that it's the apple sitting beside me. It's the fact that it's, the muscle tone is too much. So these muscle relaxers that are specific to the prostate, they work well. Side effects can include lightheadedness. So we've had people pass out, stuffy nose. If you have cataract surgery after taking this medicine even once, you have to warn your eye surgeon. Doesn't mean that it's going to be a bad surgery or some catastrophic outcome, but they've got to make some special preparations. And then lastly, some of them will cause a decrease in ejaculation. So we talked about in our last episode, for some guys, that's very bothersome. For most, if you warn them, they're like, all right, well, things are cleaner and I don't have to worry about this.
Okay.
Lastly, is a group of medicines called 5-alpha reductase inhibitors. I know, a mouthful.
That's a lot.
So what we're doing is preventing the conversion of testosterone to DHT, or dihydrotestosterone, which is a more potent form of testosterone. This is actually the same group of medications for hair loss. So Propecia is 1 milligram of finasteride. 5 milligrams of finasteride is used for an enlarged prostate. So makes sense. You got a big prostate. Let's shrink it. Let's cut down on the male hormones that are stimulating prostate growth, this DHT compound. So if we shrink it, maybe we'll start peeing better. Well, here's the problem. If you look at most of the data for these medications, they're pretty modest with how much they actually help guys. So most of the time, they don't really do what they're supposed to. They're pretty good at shrinking the prostate. They lower your PSA blood test, but they don't really cause a lot of great symptom relief. The scary side effect that not enough people are talking about is something called post-finasteride syndrome. So this
Never heard of that.
So, and the reason we've heard of it is, so with this explosion of these digital pharmacies, I won't name any of them because I don't want to get in trouble, but all these infomercials about keep your hair, and, they're prescribing these medications very willy-nilly to young men without giving them an informed consent. And so if you prescribe something in the millions, you're going to start seeing some side effects. And we've known about this in the urology community, but it's so underreported, we don't know the true incidence. Make a long story short, we have this same enzyme, not only in the prostate, but in our brain. So if we cut down on DHT in the brain, we can cause permanent ED, or erectile dysfunction, and loss of libido. And there sadly have been young men who we've heard reports of have committed suicide because they were on this medicine, they stopped it, and it didn't return. So for that reason, I am very conservative prescribing these medications. I tend to reserve it to older gentlemen who don't have other surgical options, gentlemen who are not sexually active. I don't want to make it seem like if you've taken this medicine or you're taking it now, you've got to stop it and something awful is going to happen. We believe it's relatively rare, but it's probably more common than we think. So for these reasons, medications don't sound great. So back to your earlier comment, you can't talk about surgery.
What about surgery?
I talk about surgeries the second a man comes in, because in these cases, we can save someone's bladder. We can fix the problem from the outset without causing all of these potential side effects, without popping another pill in our mouth on a daily basis.
What kind of, what is the surgery?
So here's the dirty little secret. You just said, what's the surgery, right? Right now, by my last count, and I may be off, there are about 13 different enlarged prostate surgeries.
For the same issue.
Same issue.
How can there be so many? Why?
So
different technique, different what?
The reason there's so many is money.
It's the root of everything, is the answer to everything, money.
If we're just being perfectly frank.
The answer to everything is money.
And it's not going in the physician's pockets, for the record.
Certainly
people.
not.
We actually, if you do the amount of time we put into for some of these surgeries, it's not commiserate with the risk and the work and training. That aside, it should tell you that we haven't figured out the Holy Grail. We haven't found that best surgery for all men. Because as we see, we've got the prostates in all different shapes and sizes, and what you're going to do to a ping pong ball is going to be very different than what you're going to do to this apple. So one of the reasons is that we have different size prostates. And so for smaller prostates, we have a certain set of options we call minimally invasive surgical treatments, or MIST therapies. And then for apples and plums, we've got another set of surgeries. But overall, the goal is the following. Traditionally, if we think of the prostate, I'll bring another fruit into the equation that we didn't bring today, a lemon. The goal is we want to remove all of the fruit and leave behind the peel. We want to relieve the blockage. Remember, the urine has to pass through the middle of the prostate. So if we can create a big channel for the urine to pass, we don't care if the prostate stays there, as long as we create that big channel. And again, back to our previous episode, which I recommend you guys watch if you haven't, about what is a prostate. The prostate sits near your sphincter muscles and sits near the nerves going to erection. So any prostate surgery is at risk for causing erectile dysfunction and urinary incontinence.
So this is why people don't necessarily want to rush right into a surgery. It sits near some pretty important structures, and that's delicate.
Yeah, I mean, listen, if I get you peeing better, but now your penis doesn't work and you're wearing a diaper,
Not great.
you're
Not
you're not necessarily happy about that. Now,
No.
luckily, we really walk the line and balance it really well in the enlarged prostate space. Those issues are much more common when we're talking about removing the entire prostate for cancer. That is not what we're talking about, folks. So when we think about enlarged prostate surgeries, we're really doing well. So maybe I could highlight two of the surgeries that I believe in that we offer at Pazona MD, knowing again as a caveat,
There are many others.
there's many others.
Okay.
I don't have any financial relationship with these companies, so I'm not doing it because it makes me more money or that there's any incentive. I do it because they're the surgeries I would want for myself or my loved one. So the first one is called a urolift procedure. This falls more in that missed or minimally invasive option. And what I like about the urolift is that it's a novel approach to this problem. Rather than, again, coring out the lemon, let's just pull the tissue apart, tack it to each side, and create that channel without cutting.
Sounds pretty good.
Yeah. So it was the first of its kind to look at it by this approach. Every other therapy is what's called an ablative therapy, fancy doctor term for let's get rid of all this stuff.
And cutting.
And cut it. Let's use cautery. Let's use lasers. We're now using steam and water, which we'll get to. But the urolift was this novel approach. So what's nice about it is it's a 5-minute procedure. I like doing it under some light sedation in an ambulatory surgery center or an operating room. There's zero risk of incontinence, zero risk of erectile dysfunction.
Well, that sounds very good.
We're not cutting or putting anything near these nerves. We're placing a series of these small clips to pull open the prostate. So the nice thing is it's effective. It helps about 85% of men. And at 5 years, only the 15% of men are now doing some other therapy. So now that doesn't mean at year 6 or 7, it all of a sudden stops working. We just don't have the data for that. These studies are expensive to run. But I say to a guy, listen, if I can, with 85% chance, get you urinating better with really zero risk and you're home the same day, only about 10% of people will need a catheter. Even if they wear a catheter, it's usually just for 1 day. Most guys like, sign me up. Now the limitations are some of the other therapies that remove tissue probably get some better results. And then number 2, it's something that isn't for every guy. If you've got the apple or the plum, urolift's probably not your best choice. There's just too much tissue we got to pull apart. And we don't want to go in and start throwing 20 clips in a guy. Most of the time it's about 4 to 6 clips. So it's got its downsides, but for guys who really are about minimizing side effects and want the quick, easy, let's see if this works, let's not burn bridges, I think urolift's a great option.
Okay. And you said you might have one more. You
Yeah,
said 2.
I think one more that would be worth closing on here is that one I've just started doing, which I'm really excited about. It's called the aquablation.
And this has to do with water.
Yeah. So this is.
I saw a little video of this, and it was pretty crazy. It was impressive.
It is pretty darn cool. I mean, I got to say, people ask me sometimes, why did I become a urologist? And I first tell them it's because I love balls. But
that is don't tell people that, please.
But in all seriousness, one of the reasons is that we get to play with some cool toys, and this is a pretty cool toy. So think of this as a windshield wiper meets a pressure washer.
Okay.
So this, again, this is done under anesthesia. So what I'm about to describe, guys, don't worry. You won't know this happened. And honestly,
don't freak out.
There's really minimal to no pain afterwards outside of a catheter that you wake up with. And that's usually the downside of most of these surgeries. Outside the urolift, a lot of these surgeries require a temporary catheter due to the swelling and bleeding.
But it's temporary.
It's temporary. So with this aquablation, we put a guy asleep. We put an ultrasound probe in down below. That's in the butt for those people who are not clear, to visualize the prostate. We then put this device or scope inside the urethra that has that pressure washer meets windshield wiper. We'll call it a probe. And it uses computer software based on the ultrasound picture that we're seeing in real time. And I literally touch a screen and put these dots up and go, all right, robot, get rid of all this stuff here and leave everything else behind. So we meticulously plan this surgery. And then I step on a foot pedal and this little device goes like this, and it's shooting water through such a small opening with such pressure, it just obliterates that part of the prostate. And it won't go deeper than your treatment plan. So what does this mean? Well, first, it's heatless. So there's no heat that could injure the nerves going to erections. Number two, the software and just the way the device moves has a fail-safe. It can't injure the sphincter muscle or the bladder neck. So any risk of incontinence is more or less zero. The last thing, which is cool, which is different than a lot of the other lasers and cauteries that we use to scrape out the prostate, is that we can use it to spare where the semen comes out. So we can meet that, really, I guess the quadruple outcome. We pee better, we don't pee our pants, we still have a firm erection, and we can shoot out our fluid. Like that's really what we're going for. And we'll throw in the last one, that it works a long time with a quick recovery, right? So we don't always achieve those results, but certainly of the ones that are out there, that's one I'm most excited about and have started doing. And so far, so good. So, the key though, honestly, again, going back to the fact that there's 13 of them.
Sure.
Make sure you go to a urologist who's going to listen to you and do a thorough workup. Because I've seen guys go and get prostate surgery and no one talked to them about their uncontrolled diabetes and their pot of coffee. And then they wonder why they still wake up at night. So that's first and foremost. Second, go to someone who's experienced with whatever therapy they believe in. If you go to someone who offers all of them, unless they only treat men with enlarged prostates, I'd leave. Because a guy who does everything doesn't do anything
well.
That well.
Okay.
Right.
Okay.
So, that's why, again, I'm like, you know what? I don't need 10 different tools in my tool belt. With these two, I'm pretty darn good. So I think that is the key takeaway is there's plenty of other therapies I didn't mention. And again, there's no financial incentive for one versus the other. It's just go with what you're comfortable with. And this is the art of medicine. It's trying to figure out what is best for that patient sitting in front of me and what tool am I really good at delivering. So I think if you follow those general rules that you're going to overall do well.
Well, this was a lot of information on the enlarged prostate and what to do about it. And I've learned a lot.
Yeah, absolutely.
Thanks. So I think we should wrap it up quickly, though. We've gone a little long with my favorite little segment, Just the Tip. So as the recap, the prostate blocks the urine flow and irritates the bladder. Number 2, lifestyle changes should be the first treatment before medication and definitely before surgery. And number 3, minimally invasive surgeries are safe and effective long-term treatments. If you need that, they're out there and they can really help.
Yeah, I think that's a great recap, and apologize for going a little over this week, people, but a lot to pack in. And if you want to eat the apple now, you can go for it.
These were my snacks. We're
done with it. So
great.
Thanks again, Stream Team, for another week. Again, we appreciate your support. If you don't mind subscribing on YouTube or your favorite podcast venue, and remember to show yourself a little bit more love and kindness. We are all works in progress, and those are opportunities to improve. Thanks, and have a great week. See ya.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit PazonaMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.